Admiral Brett Giroir is an Assistant Secretary of Health in the Department of Health and Human Services and leads the testing effort in the White House Coronavirus Task Force and joins me now. Admiral, thank you very much for being with us. I know this is a very busy time, but our thanks to you. And I wanted to first ask about your guidance, the CDC guidance, all the warnings. Let's communicate your message once again to the American people. Millions of people are traveling out there and ignoring every good advice that is coming from Washington.
So thank you for having me on again. And I want to stress that a vaccine is just around the corner. We expect millions of doses to be delivered to the American people in December. So the end of the pandemic is in sight. But right now, we are at a critical and very dangerous part of this pandemic with cases rising, hospitalizations rising. We had over 1,900 Americans die yesterday. So I urge America, just for a few more weeks, a couple more months, you've got to follow the guidance. This works. Wearing a mask in public when you can't physically distance, watching indoor crowded spaces like bars and restaurants, hand hygiene, being tested. Listen to the CDC guidance. And look, no one's trying to cancel Thanksgiving. What I urge Americans to do is make a good choice for you. If you can defer travel and have Thanksgiving at Valentine's Day, do that. If you make the decision to travel and be with your family, be on good behavior before you get together. Try to physically distance in the home. Wear a mask. Don't crowd people, 20 people in the kitchen like we do in Cajun land to cook all day. Do those reasonable things. Make better choices. We are just starting to see some progress from the mitigation efforts that Americans are doing. We need to continue that because we are not out of the woods yet. It's still a very dangerous situation.
What about these long lines we're seeing at test facilities? People who want to travel seem to think that getting a test is the magic bullet, getting a test before or after, but there are real cautions there. A test is just a snapshot of how you are at one particular moment.
You are right, Andrea, and you know, I'm always supportive of testing, and we need to test asymptomatic individuals according to local public health. But what I'm really worried about is people assuming that if they're negative today with a test, that means you get a free pass and you can go hug grandma and be with vulnerable individuals. And that's just not the case. It is a snapshot. Clearly, if you're positive, you need to go home and not travel. But the great majority of people will be negative, but that doesn't mean that you're safe. So whatever you do, if you get tested or not get tested, you've still got to wear the mask, physically distance. We can get through this together. But this is a really dangerous, critical time over Thanksgiving where millions of people are traveling. We know the risks for spread are going to be higher because of that. And we've just got to do our part. Make a good decision. Make a better choice. That's all I'm asking. If you don't have to travel, don't travel. If you do travel, be safe behaviors before you get there and do all the mitigation steps that we're talking about and the reporters on your show were just talking about a few minutes ago.
We see millions of people still going through TSA, so record numbers, at least for during the pandemic, not compared to past years. What's the best advice in airports? The airlines are telling us that the planes themselves are safe as long as you keep masks throughout, don't eat on the plane, is advice from our people. But airports themselves, you see a lot of people congregating.
Yeah, we're very concerned about that. I mean, we're very concerned about that. You know, biology happens whatever place you're in, and if you have congregations of people in an airport close together, the risk of spread is higher. And again, I'm going to sound like a broken record, but wearing a mask protects other people. We know that very well. It really minimizes the spread of those droplets that can infect other people, but it also helps protecting yourselves. And particularly, even though the virus is not primarily transmitted by surfaces, when you have surfaces that literally tens of thousands of people touch, that is a risk factor. So, you know, wash your hands, use sanitizer. Hand washing is great. Wash your hands as much as possible. Try not to touch surfaces. All those kinds of common sense things, they're still our best protection against the virus. And we know they work. We really do know they work. We're starting to see the effects of mitigation in the U.S. We know that in the United Kingdom and France, they had these simple steps. They've completely reversed their outbreaks in the last couple of weeks. So we can get through that. The vaccine is just around the corner.
Do you have any concerns about the CDC shortening the guidance on the length of quarantine for individuals exposed from 14 days to perhaps 7 to 10 days. Is that safe?
So this is still under consideration, and I'm involved in that and working with the CDC, but this is being prepared by career professional scientists and physicians, epidemiologists who study this. We know a lot more about the virus than we did 2 months ago, 4 months ago, 6 months ago, and the accumulating data suggest that we don't have to wait 14 days. We know that the average person will get sick about 5 days after their exposure, and then there's less of a probability. So the CDC is closely examining whether, for example, a 10-day quarantine is as safe as a 14-day quarantine, or maybe even a 7-day quarantine with a negative test is the equivalent of a 14-day. And they're not going to advise anything that isn't safe. But look, if you can get out in 7 days with a test as opposed to 14 days, you can get back to work, you can go to school, you can protect your family. And I do think people faced with just 2 weekends and 5 days, or a weekend and 5 days, 7 days, you're much more likely to obey that than 14 days. So it's going to be science and evidence driven. Stay tuned. There's no recommendation yet, but I would expect one in the next couple of weeks based on the preponderance of the evidence.
And would it depend in part on how much viral load you get, how long you've been exposed? Let's say you're less than 15 minutes or more than 15 or an hour in a closed space.
Yeah, all that does matter, but what we're really talking about here is close contact. So if you've had a significant exposure, that's who really needs to quarantine now if they're not a critical infrastructure worker. Critical infrastructure, we say wear a mask, be careful, monitor your symptoms. But for everybody else, it's the 14 days. That's the group of people that I think we will likely be able to shorten to 10 or perhaps even 7 with a test. That is not a recommendation yet. We're being very careful, and this is being driven completely by the science and evidence by career people at the CDC. I work with them, I reviewed the data with them. They are really doing a great job, so just stay tuned. That could be coming in the next week or two.
And in terms of the GSA now allowing the transition to move forward, have you or your teams, any of your senior staff, had any contact with the President-elect's team?
So I personally have been contacted by several members of the public health team on the new administration. Informally, we have not had formal transitions, but even today, a formal transition between the Biden team and Operation Warp Speed is happening. So that's a formal, very important one to get started because we know that vaccines are the way out of this epidemic. And again, in terms of testing and all the public health measures that I'm involved with, many people on the Biden team, these are public health professionals we work with on a daily basis. During normal times, we're all sort of on the same team. Our positions change, and I look forward to a collaborative, professional, and complete transition. And I really support and hope that the Biden administration can build on what I think is a good foundation of vaccines, therapeutic, and testing that we've been able to build over the past year.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.